Welcome to the Healthy, Wealthy, and Smart podcast. Each week, we interview the best and brightest in physical therapy, wellness, and entrepreneurship. We give you cutting-edge information you need to live your best life, healthy, wealthy, and smart. The information in this podcast is for entertainment purposes only and should not be used as personalized medical advice. And now, here's your host, Dr. Karen Litzy.
Hey everybody, welcome back to the podcast. So happy to have you join me today. And on this episode, I had the honor of interviewing Dr. Lars Engebretsen. And this interview was on behalf of the Third World Congress of Sports Physical Therapy. It was done live on their Facebook page a couple of weeks ago. So if you want to see the version with video, you can head over to their Facebook page. That's the Third World Congress of Sports Physical Therapy. And it was an honor to interview Dr. Engebretsen. He is a professor and consultant at the Orthopedic Clinic, University of Oslo Medical School, and professor and co-chair of the Oslo Sports Trauma Research Center. He is also a consultant and former chief doctor for the Norwegian Federation of Sports and headed the medical service at the Norwegian Olympic Center until autumn of 2011. In 2007, he was appointed head of science and research for the International Olympic Committee. He is a specialist in orthopedic and general surgery and authorized as sports medicine physician by the Norwegian Society of Sports Medicine. He serves as chief team physician for Norwegian Olympic teams. The main area of research is resurfacing technique of cartilage injuries combined and complex knee ligament injuries and prevention of techniques of sports injuries. He is currently the president of ESCA, which is the European Society of Sports Traumatology, Knee Surgery, and Arthroscopy. He is the associate editor and editor-in-chief for the new IOC BJSM journal, Injury Prevention and Health Protection. In addition, he serves on several major sports journal editorial boards and has published more than 200 papers and book chapters. I know. Where does he find the time? I have no idea. In this episode, we discuss his career shift from being reactive to proactive in injury treatment, the importance of a team approach for injury prevention in sport, programs that focus on translating injury prevention research to coaches and trainers, how to develop your research portfolio, and what he's looking forward to at the Third World Congress of Sports Physical Therapy, which will be in Vancouver, Canada, October 4th and 5th. So if you have not yet gotten your ticket to go, I suggest you head over there. You can click on the website by going to podcast.healthywealthysmart.com, get your tickets, see all the speakers. This, because it was live, I'm not going to really edit any of it because you can also go over to the Facebook page to watch the video. So everyone enjoy this episode. A huge thanks to everyone at Third World Sports Physical Therapy Conference for allowing me to do this, and to Dr. Engebretsen for coming onto the program. As you know, we've been doing live interviews with speakers from the Third World Congress on Sports Physical Therapy. And for those of you who, if you're on this page, I hope you know when it's going to be, but it's October 4th and 5th in Vancouver, Canada. And today I have the distinct pleasure and honor to be talking with Professor Lars Engebresten. So Professor, welcome. Thank you so much.
Thank you.
Yes, and as we said before, I've been practicing that name for at least a week. So, all right. Chris Napier, welcome. We said welcome to you. Thanks, Chris, for being on. It's a little bit early there over in Vancouver. So, Professor, before we get started, can you please tell the audience and tell us a little bit more about you, your career trajectory, and what you're up to?
Yeah, I'm a professor at the University of Oslo, Department of Orthopedic Surgery. And then I work at the Olympic Center of Norway, getting gold medals for Norway. Then I do work at the Oslo Sports Trauma Research Center, which I run together with Rollbar. And then I am professor at the medical school, and I work every other week for a couple of days in Lausanne, Switzerland for the International Olympic Committee. So I have a very good combination of clinical practice. I still operate and I see patients quite a bit every week. And research. I have many PhDs working on projects that are, I would say, coordinated by myself.
That's an amazing amount of work to do. It's like 5 jobs all rolled into one. And I'm sure, although this is not what we're going to be talking about today, but maybe another time we'll have you talk about your time management skills and exactly how you get all of that done, because that's an amazing amount of work to fit in. But let's dive right into, since you just mentioned that you're still doing clinical work and research. So being that clinician scientist, how important is that to merge your clinical work with your research work?
Well, I think I found out very early in my career in orthopedics how important research is. I usually tell this story. I was doing a clinic as a resident up in Trondheim, where I did my residency. And next door to me was one of the professors, and I had many patients with anterior knee pain. And I would ask him, what do you actually do with those patients? Because they seem a little bit strange now and then. And he said, I operate on all of them. So I said, yeah, what kind of operations do you actually do? And then he said, you see, I do a Maquet operation. Maquet operation is like elevating the tibial tubercle to reduce the load on the patellar side. And I said, oh, that's strange. How are they doing? And he said, oh, they all do very well. And then I actually looked up 50 of those patients in the hospital. And sure enough, about 1/3 did pretty well. 1/3 was about the same, and 1/3 was much worse. Then I realized, we can't really trust the old professors. You have to, in areas where there are some doubts here and there and what to do, you have to do research in those areas. There's no way you can be a clinician in a university clinic without doing that kind of research. So since that time, which was a long, long time ago, I've actually been doing all kinds of both clinical and basic science research.
And how does one inform the other? So how does clinical inform research and research inform clinical for you?
Well, for me, it's been like, I see patients, I follow various teams. I've done all kinds of soccer teams, handball teams, ice hockey teams, and so forth. I see the issues, what kind of problems the patients have, and I see what we have to give them in the form of various therapies or various surgeries. And I realized that we aren't really perfect, that there is a lot of research that remains to be done, actually. So that's general speaking, the way I've found out that this is something I have to do. And when I was young, I was doing all kinds of sport myself. And I also realized that, when you got injured, we really didn't have that much of armamentarium for getting people back. And that was a long, long time ago. Now we're better. We are getting better, but we still have a way to go. So the last, I would say, 30 years, I've been working on 3 different research areas. So I've been working on cartilage issues, ligament issues, and then later on prevention of injuries issues.
And, since you mentioned the injury prevention issues, let's dive right into that now. So you've been involved in conducting a number of studies regarding sports injury prevention. So what would you say are some of the common misconceptions around injury prevention?
Well, it's very difficult to get people really interested in that area because, it doesn't really pay much. At least on an individual basis, it does pay back to society because you get less injuries by doing it. But to the individual doctor or physio, it is difficult because of the payment schedule in these cases. But in my case, it was actually one specific athlete who made me change my attitude to this. So I was doing all kinds of basic science and also clinical studies in ligaments and tendons. And then was Simon, and they are very good. They were supposed to win the gold medal actually in Sydney. The star player had an ACL 8 months ahead of time, and which was a major issue, of course. And we operated on her, and it was successful, and she came back. But Norway did not win the gold medal, only a bronze medal, and she didn't really perform the way she was supposed to. And I realized then, actually, that what we were doing was not really that great. I realized that she was on track for getting osteoarthritis pretty early after the surgery. And I realized that all my efforts in ligament design and new ways of doing the surgery and stuff wasn't that great, because I thought I should spend more time on dealing with how can I prevent these type of injuries at the same time as I treat them later on. But I kind of refocused towards prevention of these injuries after that incident.
And based on your can you hear me?
You disappeared.
I disappeared? Oh, I can still see you and hear you. Let's see. This happened last time too. Let's see, I'll come back on. Sorry, everybody. Can you see me?
There you go. I can see you.
This happened last time too, technology. So getting back to this injury prevention. So based on our current knowledge of injury prevention in sport, what would be your recommendation or go-to strategy or intervention for injury prevention? So, for example, is it exercise? Is it load management? Is it education? It's a loaded question.
Yeah, no, it's okay. The most important thing is to look upon this as a team effort. There's no way you as one person will be able to make a huge difference in this area, because prevention deals with all the aspects that you mentioned. And therefore, in our case, Oslo Sports Trauma Research Center, we are quite a few people working in this field. And there's no way that not one of us could make a big difference. It's all about a team effort. And because you have to, first of all, you have to do research to figure out whether your program is working. Secondly, you have to make people do it. And third, you have to look at the results of it. And that really demands manpower, budgets, and long-term studies in this event. We've done a lot of randomized control studies showing the effect of these programs, but we still don't have perfect compliance, and what we have found out lately is that we are changing our approach a little bit towards instead of trying to travel around and give lectures on this to athletes and stuff. We actually try to teach the coaches in Norway anyway. The coach educational programs are now filled with this prevention programs that we have. So it's all about, I think, parents and coaches more so than the doctor or the physios doing it. So we have to be able to relate all the knowledge we have and to be able to implement it. And that is the biggest challenge at the moment.
Yeah, that makes a lot of sense. And because changing people's behaviors is not easy.
It's not, but at least where I live, and I'm sure also in the US, we have been able to stop people from smoking.
Yes.
Very, very few smokers left here. So we should be able to, instigate the system where if you are young and you're doing a sport, part of your sport is the prevention part.
Yeah, and I think that's a great example that, yes, smoking, when I first moved to New York City, so many people smoke. Now it's a rarity, mainly because of good outreach campaigns via media and things like that. And sometimes I think that's where injury prevention and sports injury prevention is just not getting its fair airtime, I guess. Right. So when you look at mainstream media and news and things like that, they focus on the injury. So the professional player who gets injured or the collegiate player that gets injured, this is the injury, this is the surgery, versus look at all the people who haven't gotten injured and why is that?
Yeah, there are some good examples. For example, hamstring injuries, we have a pretty good way of reducing those by maybe as much as 75%. And even in the Premier League in England, the very best teams do not really do those exercises, and it's really crazy because the number one injury keeping people out of Premier League soccer is actually hamstrings at the moment. So it's a very strange thing that we're not able to, and I think that's all about the coaches being involved and understanding how important this is.
Yeah, and what are you doing things in Norway? I know you said that now you're getting more coaches to come to lectures and things like that. So if there are people listening from other parts of the world, what sort of system are you using to get those coaches in?
Well, every country almost every country has some sort of coaches education, and it's like level 1, 2, and 3, and so forth. And now we have introduced prevention programs in all those levels, so that actually part of their sort of daily education is about prevention, and I think that's a must and a key in this area. So we have shown that we are able to reduce the number of serious knee injuries, for example, by more than 50% in some sports that are really prone to those type of injuries. Team handball is a very good example. Basketball could be another one. So I think that education there is very, very important. But as I said, we are trying out new ways of getting compliance to improve, because that's still an issue.
Yeah, you can have a great injury prevention program, but if nobody does it,
and what we're trying to do is to teach parents a little bit that if you have a daughter, 12, 13, 14-year-old, and she plays soccer or team handball, the chances of having a serious knee injury is very high. And you can really take out insurance by doing these kind of exercises at the same time that you are training. So maybe spend 10, 15 minutes 3 times a week on this. That would be able to reduce the percentage risk for having an injury like that.
Yeah, I mean, from the standpoint of the clinician and the researcher, it just makes so much sense. We just have to get the coaches and the players and the parents and team organizations and schools and things like that on board. And I would assume that takes time and some effort and the incentives.
And I think like in the US, you have in one sense a much better status because you have all the sports in schools.
Right.
Whereas in the rest of the world, for the most part, the sports are outside schools and in community teams and stuff like that, where it is a little bit more difficult to get this through. So there should be good chances in the US and Canada as well.
All right. Well, hopefully people listening to this will kind of take this to heart and go to their local high schools and middle schools and try and educate those coaches and parents. All right. Now, you already touched upon this, I think, as a particular patient case that you personally treated that caused you to reevaluate your whole treatment paradigms. And I feel like you touched upon that a little bit already. Do you want to expand on that at all?
Yeah, in the sense that for me personally, it really changed me from, doing surgery 4 days a week, to spending more work in the research lab, trying to design exercises to help in preventing these kind of injuries. We have done a lot of work on looking at why are they happening and how are they happening. And our team here in Oslo has relatively good knowledge in this area, and that has helped us in designing programs. It's taken a long time and takes you away from the OR and into a different environment. And that has really put a major change in my medical activities.
Mm-hmm. And are you happy with that change? Like,
I am.
That's a good question. Yeah.
Yeah, because I know still. I'm going to a meeting, for example, now in a couple of weeks, and I'm preparing for it in Pittsburgh on the ACL, various kinds of ACL issues. And that just tells you here all the experts from around the world is attending, and still the same question comes up and again. And there hasn't been a huge development, I would say, when it comes to serious knee injuries in the results of the treatment we have. Mm-hmm. So therefore, the area that I'm interested in, this prevention area, probably have still a lot to contribute to the field, because the orthopedic surgeons haven't really caught on, mm-hmm. at least not on the majority of them, I would say, in this. Even though if you guys have done it, the physios have done it, but the orthopedic surgeons is still lagging behind a little bit.
Yeah, and it's to me, what it sounds like I'm hearing from you is it sort of forced you to be, instead of a reactive doctor, a more proactive physician.
Absolutely, right? Yeah, that's a good point, and that's a difficult change.
Mm-hmm. Yeah, especially because you had a lot of training, but it's still all medicine, and in the end, it's helping the patient, which is the most important thing. That's why we do what we do, right? Mm-hmm. All right, so as we said in the beginning, you're also a researcher. You have an impressive publication record, hundreds of peer-reviewed articles. So if you kind of take a look back at all of those articles that you published, which one of your research projects or papers was most meaningful to you? So maybe it doesn't have the highest altmetric score, but which one to you was like most meaningful?
For me, that's very difficult to say, actually, because I have not because I have so many, but more so because I have various fields that I've been very heavily involved in. There were some really important ones in the beginning when I was working in the lab and then taking lab work to the OR. But I think that overall, the most important one is probably the one we did on prevention of ACL injuries in team handball in Norway, where we followed this for 10 years. And we could see that, when we went in there actively, we were able to reduce the number of injuries. And then we kind of stepped out and let the players do it themselves, went back up, all the injuries. And then we really reinforced our efforts, and all of a sudden we were able to really reduce the number of injuries again. It just shows us that if you really have put your mind to it, you can really achieve something. So that's probably the most important paper that we have come up with. But again, this is all about a team thing. It's not something that I've done myself. I've been part of a whole team. Yeah. So I think that's probably the most important one.
Nice. And then what advice would you have for young researchers who are trying to develop their publication portfolio?
Yeah, I keep telling my co-workers in the hospital at the university that although it is great to have patients and to treat them and see that they're doing fine, still, if you've been doing that for 10 years, you kind of get bored after a while if you don't really progress and develop yourself. So you have to be able to do some sort of research during your clinical work as well. I'm really trying to tell them some examples here and there, why I did this and that. And it is absolutely possible to combine busy clinical practice with some sort of research, at least if you're able to work as a team. So you should always, have other orthopedic surgeons, or in my case, physios and trainers that you work with, which will enable you to do much more than you can do only by yourself. But I think the most important advice is to, if you look at your 10 last patients and you really take a close look at them, then you realize that, there are many things you don't really know. So there are many things that needs to be researched. Mm-hmm. I had one young person come up to me a while ago saying that he was discouraged because there's nothing more left to research. And that is so wrong, because
everything's been done.
Everything has been, yeah, that's what he said. You guys have done so much, so everything has been done. And that is absolutely wrong. There's so much left to do. So there's work for everyone.
Yeah, I would think there would be. And now let's talk about what you're going to be speaking about at the 3rd World Congress on Sports Physical Therapy. So can you give us a little sneak peek as to what you're going to be speaking about?
Yeah, I see from the program that I'm going to talk about ACL, or cruciate ligament injuries, and surgical treatment versus non-surgical treatment. And that's something that we have been working on for a while in Norway, and also with other groups around the world, actually, where we have lots of research been showing that in Norway, we actually do about 50% of our ACL patients are having ACL surgery. The reason is that, people that are not doing pivoting activities or pivoting sports, they are completely able to continue what they're doing without having a reconstruction, things like that. The key there is, of course, range of motion, proprioception, strength, and if you are able to do that, then you can do well without having an ACL reconstruction. And even if you have an ACL reconstruction, if you don't do those kind of rehab, you'll never be successful. So that's probably what I will be talking about, and some of the results that we have from our area in the world.
Sounds great. I look forward to it. And I think it is amazing that it's only 50% of people in Norway. I feel like in the US, it's much higher. You probably know the figures better than I do, but just from an anecdotal standpoint, it seems like the moment someone has an ACL tear, they're having surgery regardless.
Yeah, the point is nobody knows that in the US, because you don't really, have the numbers on people not having ACL injuries.
Oh, okay.
It's very interesting, because I've been working with China actually on developing an ACL program for them. And, they have thousands of ACL injuries, but they have no clue on how many actually, because they think they have most of the injuries in China is not really being operated on, at least not until now.
Yeah.
But you are right. In your part of the world, if you have an ACL injury, you will be operated on automatically almost. And the same goes for Central Southern Europe. It's the same thing. In Scandinavia, Sweden, Finland, Denmark, Norway, we're tending to operate only on the ones with pivoting work or pivoting sports. And the rest we don't do. So in Norway, we have about 4,000 ACLs a year. We are 5 million people, 4,000 ACLs, 2,000 are seeing surgery.
Right. Yeah. It's we'll see what happens as time goes on and people start to realize that maybe there are some other options. But I'm definitely looking forward to that talk in Vancouver. And are there any talks that you're looking forward to, or people you're looking forward to seeing?
Yeah, I look forward to see some of the PT work on the new ways of getting people proprioceptively sound, new ways of testing people for return to sport, things like that. That is really something that interests me.
Awesome. Well, I have to say, I want to thank you so much for taking time out today. Is there anything we didn't cover? that you have like a burning desire to talk about before we end?
No, I look forward to come to Vancouver. It's a wonderful city. I was there during the Olympic Games in Vancouver, and was up at Whistler and also down in Vancouver, and it was a beautiful area. So I look forward to see that again.
Yeah, me too. The only time I've been to Vancouver was when I went to Whistler to ski. So I was only in Vancouver for as long as it took me to get off the plane, get into a car, and drive up to Whistler. So I'm definitely looking forward to spending a little more time there. But thank you, Professor, so much for taking the time out and speaking to everyone. And Chris and everyone else that's watching, and Mario gave a thumbs up, Mario Bazzini. Thanks so much for tuning in. And hopefully we will see you all in Vancouver, October 4th and 5th. So thanks so much.
Thank you.
Thank you for listening, and please subscribe to the podcast at podcast.healthywealthysmart.com. And don't forget to follow us on social media.